AARP District of Columbia and the Washington Informer have brought together 4 candidates for the at-large seat in the district council so that you, the viewing audience, can learn what these candidates stand on issues of particular interest to you and to you older Washingtonians and their families. These issues include escalating housing costs for people aged 50 plus, sustaining livable communities across the District of Columbia, food security, and addressing health disparities. AARP has 83,000 members in the district, and in the Washington Informer has a readership to cover over 63,000 and another 725,000 social media viewers. And together they will share what we learned tonight with residents across the district. I will now turn it over to tonight's moderator, Louis Davis Jr., AARP District of Columbia State Director, and Denise Rolock Barnes, the publisher of the Washington Informer. Thank you.
And thank you, Ron. And thank you to our candidates for joining us tonight and all of our listening audience. To our candidates, again, make sure you stay on camera at all times and keep your mics muted. I'm Louis Davis Jr., State Director of AARP District of Columbia, and we're happy to have you here this evening. To my left,
I'm Denise Rolock Barnes, publisher of the Washington Informer, and really thrilled to have you all here this evening. I know it's been a long road to on the campaign trail to June 21st, when we will have our primary election here in the District of Columbia. But we look forward to your remarks and your comments as it relates to the issues that are important to seniors here in the District of Columbia. So where we'll start, each candidate will be given 30 seconds. I know you're all accustomed to these time limits, 30 seconds to give your opening remarks. And we will start with Lisa Gore.
Good evening, everyone, and thank you for being here tonight. My name is Lisa Gore. I'm a proud third-generation Washingtonian. I'm a DC public school mom, ANC commissioner, vice chair of ANC 34G, and a retired federal law enforcement officer. I've lived throughout DC, including wards 1 and 5, and I currently live in the Ward 4 section, Ward 4 in the Hawthorne section. I'm running to fight for justice in housing, education, transportation policies. And at the launch of my campaign, I organized a platform on aging and health services. I believe my lived experience, my combined experience as a mom, a federal investigator, and an ANC commissioner will make me the best candidate to transform the needed services for our residents here in DC. Thank you. Look forward to talking to you tonight.
Thank you. And we'll go next to Anita Bonds, Councilmember Anita Bonds.
Thank you very much. And thanks to my organization. I've been a member since I was 45 years of age. And so it's a pleasure, of course, to be here. And of course, I think the Informer is one of our stellar publications in the community that needs to be promoted more. I'm here because I care about the senior citizens in our community. Senior citizens are in my committee that I currently chair. I was assigned to the Housing Committee, and so seniors are in the Housing Committee. And one of the things that I'd like to do is to expand the opportunities for all of our seniors to age in place. And I mean that beyond just a theme, to make sure that we have the services in place that we really do need. Housing is at the top of the list, and so is the cost of living, particularly when we think about defeating hunger and also abuse. There's tremendous amount of abuse in our community. So I want to make sure that we live up to the goals and values of our community. And that means at the top of the list, taking care of our senior citizens that have given so much to this community.
Thank you so much, Mrs. Bonds. Candidates, we have actually already broken our rule about 30 seconds. So since the other two candidates got about a minute, we will proceed with that time frame for the rest of the candidates. Mr. Nate Fleming, you're next.
Thank you. My name is Nate Fleming, and I grew up in DC, raised by a single mother. An educational opportunity took me to Morehouse College, law school at Berkeley, and Harvard Kennedy School. And I believe growing up in Southeast that when you get these opportunities, you have a responsibility to create opportunities for others. And everything comes back to my mother. My mother, when I was born, was a corrections officer at the DC Department of Corrections, and she really focused on education. And currently my mom is suffering from breast and lung cancer, and I'm her caretaker. So it's given me a special insight on the issues that affect the 85,000 older adults here in DC. So I believe that I can be effective on the issues for them. And the issues that affect seniors are the issues that affect all Washingtonians. For example, 1 in 4 seniors that live in wards 1 and 8 are below the poverty line. Seniors are the highest number of pedestrian fatalities in the district. And issues like housing costs and the need for multi-generational housing are the type of issues that I think I can deliver on for Washingtonians. So in this hearing, I look forward to learning more about the issues and telling you more about what I've done as a council staffer, and including one, bringing a new senior wellness facility to Ward 8. And secondly, I've had experience as it relates to expanding the supports for grandparents that take care of households.
Thank you,
So
Mr.
I look forward to discussing this with you today.
Mr. Fleming. All righty. And next we will go to Mr. Dexter Williams.
Thank you. And I want to thank AARP and the Washington Informer for hosting tonight's forum. My name is Dexter Williams. I'm a native Washingtonian from Ward 7. My mother is a retired DC public schools teacher, and my father also worked at the DC Department of Corrections. I have worked at the DC Council for at-large Councilmember Robert White, focusing on criminal justice issues, environmental policies, and returning citizens, and also provided oversight over the Department of General Services. I was also active in the community, and I'm also the elected Ward 7 Democratic State Committee man. And so this evening, I'm really looking forward to learning more about issues impacting our seniors and how we can be more helpful and work together. And so I'm looking forward to this evening's discussion. Thank you.
Thank you very much. Louis, do you want to take the first question?
No,
Okay.
you have it.
All right, I've still got the floor. So you have a little bit more time to elaborate on the first question that we're talking about this evening, which addresses the issue of senior hunger. There are more than 30 government-funded services and programs to help seniors get enough food. Still, according to more than one source, over 13% of seniors in the district are experiencing food insecurity. If elected, what policies and strategies would you implement to help ensure that no district senior goes without nutritious meals? And I'll start with you, Ms. Gore, and you have 2 minutes to elaborate.
Thank you for that question. It's very important. The district right now, as you said, is facing food insecurity. Not only are we facing food insecurity, a recent report from Feed America found that DC is actually #1 in the country for food insecurity. That didn't just start, obviously, overnight. We have a lot of work to do. One of the things in my platform, I call for a committee on aging and health, and the state of food insecurity for seniors is one of the reasons why I call for that. You're right, we have a ton of agencies and programs, probably closer to 90, that are dedicated to senior services in DC. And one of the things that I think that is most problematic is the coordination of those services. It's not a lack of will, it's not a lack of money, it is a lack of oversight and coordination. The council member that actually passed comprehensive legislation on this issue was Mary Cheh. Mary Cheh introduced a bill in 2021 to tackle that problem. Our approach is a little different, but we both agree that we need oversight. I fully support that legislation, including increased access to SNAP, formulating a committee to address these issues and to figure out how to better coordinate these issues, to make programs less cumbersome so seniors don't have to worry about some of the entry requirements, and just comprehensively looking at this issue and getting a hold of it and taking action on it immediately.
Thank you very much. Ms. Bonds, Anita Bonds.
Yes. Thank you for that question. It's a very important one, particularly when we think about where we have been in the services for our seniors. As you know, both of you know, we currently have a meals program that is provided for from the Department on Aging. Once was the Office on Aging, but I was happy to get the name change and the services increased so that it's now a Department on Aging and Community Living. And through that process, we not only have conjugate meal locations, but we certainly also deliver meals to our seniors that are in need. The bill that has been spoken of that Mary Shea wrote is one that I co-introduced with her. And the goal is to bring all of the resources that speak to hunger, particularly for seniors, into one so-called avenue, so that we do not have the splintering that we currently have now. A lot of nonprofits are very good at wanting to get surplus food out to our seniors. And we also have other groups that are doing a lot of research as it relates to the nutrition of our senior citizens. And so the idea is that all of this will be brought together and it would be coordinated through the Department on Aging and Community Living. I think that it is the right direction in which to move, but I also know that there will be, in the meantime, seniors that are in need of food. And so one of the goals of the department is also to advertise more, I guess broadly, the types of services that that office can provide to our seniors. And we're also asking our ANCs to begin to look for situations where there's a need for food in the community.
Thank you so very much. Mr. Fleming.
So I'll start from a personal level. Just as a caretaker for my mom, I love my mom's cooking, but she's not able to cook for herself anymore. And she really relies often on food delivery services that have high fees to maintain her nutrition. And she has the means to do so, but so many seniors don't. We had about 6,000 meals delivered last year, but that doesn't even meet the demand. So one thing I'm proposing is an outreach team that goes and knocks on doors and contacts seniors throughout the city to connect them with information. I believe that isolation is one of the biggest problems that we face. We have many programs. One thing I would specifically do, some of them have age requirements at 65 years old or 60. We should reduce those. And some of them have income requirements. To the extent that we can, we should be reducing those income requirements. But many of our seniors live in food deserts. So as a council staffer, I was the legislative director for Ward 8 and the director of the Committee on Recreation and Libraries and Youth Affairs. I wrote a law called the Wards 5, Ward 7, Ward 8 Food Desert Restaurant Incentive Act, which has led to 9 new sit-down restaurants and food options being available in these wards. But also we have a program called the Gleaning Table, which connects faith-based organizations to deliver and serve meals. We need to expand that. We know that older adults are more connected to faith-based organizations, and faith-based organizations are scattered throughout our communities. We need to empower as many of them to be a resource for our seniors so they're isolated and connected on many issues, particularly food security.
All right, thank you very much. And Mr. Dexter Williams.
Thank you. This issue is actually very embarrassing that we are a resource-rich city and our seniors are still being treated this way. On a personal level, my father suffered from a heart attack last year and he wasn't able to cook anymore or provide for himself until he recovered most recently. But during that time, it was really hard trying to figure out how we can get meals delivered to him, which government agencies were responsible for this. And so I would hope that the council would act with urgency to pass a No Senior Hunger Act. I'm not sure why we're waiting so long. This is such a major issue, but also we had a pilot program where where the government was partnering with Uber and Lyft to take seniors to their medical appointments and also to the grocery store. And it no longer exists because the funding ran out. And so I, as council member, will introduce legislation to create a program to make that program permanent. I think that we have to be innovative as we're trying to address these chronic and systemic issues.
Thank you. And let me just say that for those of you all in the listening audience, if you have questions, feel free to put those questions in the chat. And Louis was going to say the same thing, so you can proceed, Louis, with your questions. But please make sure that you do put your questions in the chat, and he may have more instructions on what we will do at the end of the program.
No, you did just fine. Hello, everyone. Again, I do want to plug our mayoral forum. The Washington Informer and ARPDC will be sponsoring a mayoral candidate forum on May 20th, this same time, this same bat channel. Stay tuned for more information about that in the coming days and weeks. Next up, and I will add, if you have questions about hunger, the topic we just got done talking about, begin to put those inside the chat. We're about to talk now about broadband or high-speed internet connectivity and access. So your questions about that, begin to put that inside the chat as well. To our candidates, and I'll come to you in this order: Dexter Williams, Lisa Gore, Anita Bonds, and Nate Fleming. Topic: broadband, high-speed internet connectivity. Many nonprofit organizations, city agencies such as the DC Public Libraries, and places of worship in the district provide access to the internet in under-resourced communities. While these institutions provide a bridge, the district needs a better strategy to close the digital divide. If elected, what would you do to ensure a strong infrastructure plan is developed and executed, bringing these groups and others to the table? Dexter Williams, you have 2 minutes.
Thank you. We have about 38% of our senior population who do not have access to the internet. And I think that is a real problem. They can't, we're in a new reality because of the pandemic. And so, for example, for this forum, which is now virtual, I do wonder how many seniors are able to participate in a forum about them. I think it's a real access issue. I think that we need to create a program, a comprehensive plan to address this issue and identify where these seniors are who do not have access to the internet, to internet services, and make sure that we're actually providing incentives and programs and grants to actually pay for computers and internet services for our seniors, but also building on what AARP did, I believe, last year, where they hosted a virtual forum for seniors to get access to information about low-cost internet services, and also partnering with the private sector to expand on that program. That's what I would do when elected as council member.
Thank you. Lisa Gore.
Thank you for that question. It's very important. And given the information that we just received, you think about this forum in general, which is a forum dedicated towards seniors. And we have many seniors in DC that can't watch this forum because they don't have the technology or they don't have the broadband access to do so. We also think about the pandemic with vaccine registration, how many seniors were left out of that. As an ANC commissioner in wards, representing 2 wards that are the most predominant wards for seniors, wards 3 and 4 in the city, I can tell you how difficult it was. And I personally went door to door, foot to foot, to the senior neighbors in my area to make sure that they got the vaccine registration information. So I think this goes back to my call in my original platform for seniors, which I list out various reasons why we need a dedicated committee. There are so many issues involving seniors, whether it's broadband, housing, food insecurity, that this population warrants dedicated oversight. And this is one issue that is definitely predominant in that area. So I would start by strongly advocating for that committee, where we have dedicated oversight to ensure these issues like broadband access are not only funded, training is provided, but that we actually get this through to seniors in a timely manner. It's that important.
Thank you, Ms. Gore. Councilmember Bonds.
Thank you very much. As you may be aware, many in the audience know that the government is putting a lot of emphasis on getting the broadband services throughout the district, and particularly in neighborhoods where it's been very weak. I think given our situation during the pandemic and trying to get the services to our families, where we had our young people, trying to give them the opportunity to continue learning, was open our eyes broadly throughout the city. And there are areas where we do not have the service that we need. And one of the things that we are doing with the current budget is budget plan. It does include not only resources for broadband expansion, but also for the devices themselves. And so through the Department of Aging, there will be devices available. Now, this is not the first time that this issuance has been made available for our seniors. Also, training is available because that's a great part of the process. But I always advocate, let's also give our seniors smartphones, because so many are using a phone, and they find that a little easier, something that they can have with them at all times. But there are plans and there are programs in place that are helping our seniors navigate the airwaves. And so I'm comfortable with that. Can we do more? Of course we can. But the biggest issue that we have in our senior community is isolation and trying to identify those who are in need. And it may sound easy to say that you'll reach out to your neighbor, you'll knock on their door, what have you. If people don't come to their door, if they are feeling a little isolated, we have found to be the case. We have a navigator system now that operates from the department that is doing just that. And the results are showing that we are still having a hard time reaching everyone. And so we have to have some other medium. And I think the mail is still one of our most reliable systems for reaching our senior citizens.
We want to do this. Yeah, if we have to say thank you several times, we don't have to mute you. Next up, Nate Fleming. You have 2 minutes.
I had 2 minutes, you said?
Yes, sir, go ahead.
2 minutes. Okay, thank you. Well, I think this is an issue that I agree with Councilmember Bonds largely on. Only 58% of older adults have a smartphone. So we need to get that number definitely up to 90%. We need a program that's going to focus on a local program creating subsidies for smartphones. But the issues as it relates to digital and broadband coverage come down to affordability and digital literacy. And too often we don't have a federal program that does digital literacy for older adults. So that's one thing that we certainly need. But in terms of your specific question, what are we going to do to expand broadband? There's many states, 22 states have something called community broadband networks that provide fast, affordable fiber internet to seniors and to the community. And that's what I'm proposing here for DC. And that's really important because so many things like telehealth are moving online. So seniors need to be digitally literate and also need to have access. The program that is federally funded is called Lifeline. I'm sure you guys are familiar with it. The coverage that's on that program is very limited. And so that's why we need, like you said, a community broadband network. So that's something that I would specifically work on, but also making sure that we can improve digital literacy. Like many people have said, we're not going backwards. So what we have to do, and we know that older adults are living longer. So we have to make sure that people have the tools, the access, so they can gain new skills and be connected to telehealth and so many things that people need to be successful in today's world. Thank you.
Thank you. Denise?
Thank you. So now we're going to change our conversation to health disparities. And healthcare spending in the district has been consistently higher per capita when compared to other states. This level of spending may suggest residents are sicker, particularly residents of color. We do not know how much of this circumstance is a direct result of the district's healthcare system, but we do know that health is shaped by many conditions of a community. Disparities in educational outcome, access to jobs with livable wages, access to healthy and affordable food, and environmental conditions may help explain poor health. If elected, what policies would you put forward to reduce racial and ethnic disparities in access to affordable, high-quality healthcare? Mr. Fleming, we will start with you. You have 2 minutes.
Thank you. As I mentioned earlier, I served for the past 5 years as the legislative director for the Ward 8 council member and as the committee director for the Committee on Recreation, Libraries, and Youth Affairs. So we've done a lot of work. As you spoke about, life expectancy for Ward 8 residents is far less than life expectancy for residents throughout the city. And part of that is lack of access to a high quality healthcare system. And that's something that we've worked to create. And we've had some progress with the groundbreaking of the new hospital at St. Elizabeth's. So that's evidence of what we need to do. But 1 in 4 seniors in wards 1 and ward 8 are below the poverty line. And healthcare outcomes are certainly less for those that have challenges meeting basic cost of living. So those are things that we need to do. When I was at the council, $25 million was cut from the United Medical Center. And I was instrumental in making sure that we restored that funding. So those are the type of things that that we need to do to move forward on this issue, especially as it relates to connecting people to healthcare services. One of the specific things that I think we need to do is ramp up telehealth services, particularly in terms of the provision of mental health care. We're moving forward in terms of having the ability to deliver high quality healthcare at lower costs through telemedicine. And I think that's something that we should really leverage, particularly in communities that have lack of access to healthcare. So that's my answer to that question. Thank you.
Thank you so much, Mr. Fleming. Next, we'll go to Mr. Dexter Williams.
Thank you. Yeah, this is a personal issue for me. Like I mentioned earlier, my father suffered a heart attack last year. And, I can just say from my own experience and, we're dealing with the issue with my dad, cultural competency in the hospitals when it comes to African-American patients is not where it should be. And so I think there needs to be a lot of education. I think that the district needs to partner with our area hospitals to make sure that there is cultural competency. But also, like I mentioned earlier in the forum, we need to bring back the program where we are making sure that people who are in disadvantaged communities within the city have access to transportation and can actually go to their healthcare appointments, which is why I'm a big proponent of partnering with Uber and Lyft and other rideshare providers to kind of close that gap. And so as council member, those are the main things that I'm going to be pushing for.
Very good. Thank you. And Ms. Gore, Lisa Gore.
Thank you for this question. I think, one of the things I think about when I think about this issue is just the immediacy of access to health care, especially in communities that are disinvested in. So we definitely have in DC the haves and have-nots. We have communities that have great access to health care, and we have communities that are still struggling in that area. One part of my platform calls for what's called a 15-minute city, where everything that you need to thrive is located directly in your community. So if we had great immediate healthcare access within our communities, I think our health outcomes would definitely improve. So I believe we have to invest in those communities. We have to put those clinics, healthcare facilities right directly in the communities that need them the most. And those are also the communities that do have lack of transportation. So seniors don't live, most of our seniors in those areas don't live within good access to transportation resources. So they have to travel out further. Having those clinics and access to healthcare right in their immediate area is going to improve that healthcare outcome for everyone. The other thing I would focus on heavily is environmental justice. In DC, environmental justice is a big issue because most of our environmental or industrial zoning are in Black and Brown communities, and that has created a tremendous amount of health disparity.
Thank you very much. And Councilmember Bonds, you have 2 minutes.
All right, thank you very much. This is such a important topic. When we think about the health of our senior community, we know that having access to health services is number one. Yet we don't have it as fragrantly as we certainly need to have the services. I'm very excited about the opening of the services that we will have over at St. Elizabeth's, because I think that gives us an additional shot in the arm, so to speak, so that we can do more for the many seniors. I was very unhappy with the closing of Providence Hospital, which is in my neighborhood. I live in Ward 5. But it is, those things do happen. And so how does the government assist the residents and make a condition better for them? And I think we do need to have more clinics throughout the city. I think that is necessary. And I think we need to have more mental health services available at the neighborhood level. And I know we have put a lot of emphasis on what happens in the ground floor of the residential buildings as an example. And we're doing a lot of building of apartments. And I think, yes, let's look to not just daycare centers, but also let's include some of these, quick stop by clinic type environments. I think too, we need to do something about the prescription drug costs. And I hope that we will be able to lower that cost a little bit in the city. As you know, we primarily get our money through our real estate taxes, but I think it's time for us to start thinking about how can some of those taxes benefit our seniors where it would help them the most, because it's very disheartening when individuals say, I have to make a choice between food and my medicine.
Thank you very much. Louis?
To our audience, if you're just joining us, to put a question to the candidates, put it in the chat box. We're talking tonight so far about health disparities impacting primarily African Americans here in the District of Columbia, broadband or high-speed internet connectivity and access, affordable access inside the home, I might add. We have broadband access inside of our wonderful public libraries, but we're meaning broadband access inside the home. And senior hunger was the other topic.
That was it.
If you have questions about any of those, please start to put those inside the chat, and we'll be getting to those before the end of our program tonight. Also, if you're just joining, you may not know the format we're using this evening. Each candidate has 2 minutes to answer a question put to him or her. If any candidate invokes the name of another candidate, you've just given that other candidate 30 seconds to respond in fairness. So those are our rules here this evening. Again, put your questions in the chat box and we'll get to those shortly. Our next topic, related as well to health disparities, but here it's pertaining to a particular population group here, or a number of communities here in the District of Columbia. The Older Americans Act requires the Department on Aging and Community Living to engage in outreach to the LGBTQ+ community, particularly here, the older members of that community, to collect data on their needs and to collect data on how they are meeting those needs. DC law also says that both the LGBTQ+ older people and older persons living with HIV are to be prioritized so that we don't leave them behind. Some states have LGBTQ+ targeted senior centers, targeted housing, and other home and community-based services and supports for this community of older residents. According to Councilmember Bonds first, Nate Fleming, Dexter Williams, and Lisa Gore with this question: how will you ensure that the district is meeting the health and long-term care needs of its LGBTQ+ older residents, including people living with HIV, two frequently underserved populations? Councilmember Bonds.
All right, thank you very much for that question. And just coincidentally, today I was meeting with the Whitman Walker group that is going to have a new facility over at St. Elizabeth's campus. And that's pretty exciting because they do everything. It's a full array of health services in addition to particularly being concerned with those who are in need of assistance because they are suffering from AIDS or HIV. As it relates to our senior population, I have concentrated a lot on senior housing as it relates to the LGBTQ community. And each year that I've had any budget authority through my committee, I've been able to sort of fund a few of the vouchers that would go specifically to that community. And so that helps because housing is also a part of this conundrum, this situation that we're trying to address when we talk about our LGBTQ community. So that's one thing. The other part is, as it relates to the health, meeting the health needs, I think we do need more information, but more than information, we also need to have health services more frequently available throughout the community. And I think it's time that we have everyone coming to our neighborhood health clinics. And I'd like to see that kind of network put in place. Doing health is very difficult, as many of us know, because you've got to have the practitioners. And as you know, in the district, we are down in the number of health service providers. So that is, again, a challenge. But I think that that should be a goal that we aspire to, and I think we can reach it.
Thank you. Nate Fleming.
Hearing something.
Thank you so much. So I think it's really important to recognize that the issues that impact seniors, the issues that impact LGBT seniors are the issues that impact everyone. And the biggest issue related to seniors is isolation. 75% of DC seniors live alone. And so we do have programs that you spoke about that speak specifically to LGBTQ plus seniors, like the Capitol Hill Center or the DC Center that provides outings. And those are the type of programs that I think that we should scale up. I do think that we should have more specifically focused centers for this population. But at the same time, there's things that we can also scale up, like the Silver Circles group, where LGBTQ centers get together to offer support and just have talk circles. Those are the type of things that we need to do to make sure that people aren't isolated and we create community for people. But also on this issue, I think it's important to understand that some candidates talk about what they want to do, or they talk in broad strokes about their platforms, but I speak about specific concrete solutions and things that I've done as a committee and legislative director. So as a legislative director of the council, I worked on the new law, the Care for LGBTQ Seniors and Seniors HIV Act of 2020. And one of the things that bill does is creates a long-term HIV care Bill of Rights for seniors. And those are the type of things that we have to work that are implemented properly. And that's something that I would do as a council member, is to make sure that HIV Bill of Rights for seniors is something that's implemented and carried through. Thank you.
Thank you, Nate Fleming. Dexter Williams.
Yeah, thank you for the question. This is a community that has faced a very high level of discrimination and abuse, particularly in the healthcare system. And so I think we need to look at what type of protections we need to put in place, what type of education that we need to do. But also, as council member, I want to form an advisory group, like with Casa Ruby and with Mitt Walker, to come up with an actual strategic plan on what we can do for the community to make sure that they have safe spaces. Is something that we did when I worked in Councilmember Robert White's office. Actually, our committee put money in the budget for safe spaces, and it's something that I want to build on. I just think that we have to. This has been going on for such a long time, and as a city, we're not doing enough. We're talking about the issue. You know, we talk about it every election season. We go to community meetings and talk about it, but we're not really putting our money where our mouths are. And so as council member, that's what I want to do. I want to work closely with the community and make sure that we are doing everything that we can to make sure that they have access to healthcare and to really eliminate the discrimination that shouldn't be occurring in the first place.
Thank you. And again, if you're just joining or if you've been with us for a few minutes, if you got a question for any of the candidates here, if you have a question for a particular candidate, let us know that too. Put it inside the chat box. We're talking tonight about broadband or high-speed internet connectivity, health disparities impacting the LGBTQ plus community, and anyone else that's experiencing health disparities here in the District of Columbia. Hunger. Surely you might know somebody who's in one of these categories who needs a hand up and not a handout. Put a question in the chat box and tell us what you've experienced yourself or what someone in your neighborhood, a friend or family member is experiencing. Okay. Candidates have 2 minutes to answer questions. And next up is Lisa Gore.
Thank you for this important question. I agree that even though we've had action on this past, it obviously hasn't solved this solution or this issue. One of the things that I would really heavily focus on is outreach in this community, and particularly with the focus on gathering sufficient data so that we fully understand what the health issues are and what those disparate impacts are. Data is going to be our first weapon to address that. And I don't believe that we have that. We have sufficient data to let us know what exactly those disparities are. Secondly, I agree with my colleagues that this is a community that has struggled with and faced disparate treatment, hostile treatment, and all of that creates an atmosphere that makes the community less likely to accept healthcare early and often. And that's going to be something that's going to impact their outcomes as well. So we absolutely have to have policies in place that protect the community, make sure that they're comfortable coming in and receiving healthcare. But we also have to do a better job in outreach to these communities so that we know and fully understand what those issues are so that we can address them.
Thank you so much.
So we, of course, have other questions. And at some point, I want to make sure that we figure out what your priorities are as it relates to the issues that impact seniors. We've come up with a list of our own. We've been through that list, and we want to make sure that our viewers get a chance to ask their questions as well. But we also want to know, what is that first thing you plan to do, that first piece of legislation that you have on the drawing board that will impact seniors. Before we go there, though, however, we are going to ask about healthcare disparities. One of the viewers has suggested that healthcare disparities is not a new issue and that there are a variety of studies that have addressed this issue. But what would be your first plan of action to address the quality of care and lack of customer service follow-up impacting seniors? And Mr. Williams, Dexter Williams, we'll start with you.
Thank you for the question. I mean, you're right. I mean, this has been going on for a number of years, and I think this is where oversight comes into play, but also we have to work with our hospitals and other healthcare providers in the city in partnership to make sure that our seniors are getting the quality of care that they need. We need to be innovative in our approach. We need to make sure that they have access to transportation. We also need to make sure they have access to grocery stores because a lot of these issues come from what we're eating in our diets. And sometimes if you don't have access to healthy foods, it leads to healthcare issues. And so one of the things that I'm going to do as council member is make sure that we have that plan in place, make sure that we are working with our partners, make sure the administration is doing and living up to its mission.
Thank you very much. Lisa Gore, we're going to come back to you.
Thank you. And, when you're thinking about those healthcare disparities for seniors, as we discussed, there are a tremendous amount of things that contribute to that. Access to quality healthcare in their neighborhood, food insecurities, not having healthy food access, the environmental justice issues that create health disparities, lack of transportation, getting to and from doctor appointments. And I definitely agree. This is a major oversight issue. We did not get to number one, food insecurities for seniors in the United States, by happenstance. These are policy choices that we've made, and these are policy choices in the past that were wrong and dug us further into this situation. So I definitely stand by my platform and my desire to have a dedicated oversight committee on aging and health issues. We have 90-some plus programs dedicated to seniors, and they lack oversight and coordination. And I think that is a way to get our seniors out of some of these tough issues.
Thank you very much. Councilmember Bonds.
Thank you for that question. I want to start with making it very clear that the Department on Aging, along with the Department of Health, are primarily the players in what we're discussing at this moment. And I guess many of the listeners are very much aware of that. And so when we talk about disparities and we talk about putting together a plan that works and that engages more of our senior population. We just have to make sure that we're talking about the same thing. We're not talking about hospitals, and we're not talking about food distribution centers. We're really talking about the nutritional value, I think, that our senior citizens have access to and actually consume. And being a senior myself, I certainly do not take up kindly to the implication that somehow seniors are helpless and that they need all these services that someone has to provide for them. I think a lot of this is information, knowing where the services are. And so we are challenged every day to make sure that the information is available. My mom is 99. She has all of her upstairs head faculties, as I call it, and orders the rest of us in the family around. And she gets around as well. And she got to be 99 by not doing the best for her so-called health, but she's there and she is mobile. And I think that she is a representative of many seniors who are going to live a very long life. And so my goal is to make sure that we prepare for them in such a way that we would like to be prepared for with all of the services.
Thank you, Councilmember Bonds, and we hope so as well. Mr. Nate Fleming, you're next.
So yes, I think it goes, so I've knocked on a lot of doors. And when I knock on doors in this campaign, I talk to mostly seniors. And sometimes people say, oh, well, it's just not easy just to make an outreach team for seniors, but it is. If I'm out there knocking doors to get seniors votes, we can have a team of professionals, just like the Mayor's Office of Community Relations, that's out there knocking doors, calling seniors, connecting them to the information that they need. But part of the issues as it relates to health disparities and the quality of care is making sure that there's quality healthcare facilities in each part of the city. And we don't have that right now. And that's something that I worked on as a staffer at the council. But that problem also impacts hospitals elsewhere. So when you go to GW Hospital, there's more load there. There's more load at Howard. There's more load at Georgetown. So that impacts all of our healthcare. So that's one thing we have to do, is make sure that we have quality options everywhere. We also have a licensing board as it relates for these health facilities. So I think we should mandate that there are opportunities for people to make complaints and for those complaints to be resolved. But in terms of these disparities, we have to deal with them on the front end. They're the result of systemic racism, whether that's tobacco, whether that's the lack of quality food options in our communities. So we have to do that as well. And one final thing is I want to make it easier for seniors to be able to have home health care workers in their houses. I think that's something that's going to also help in terms of preventing isolation. And that's something that certainly has been helpful with my mother.
Thank you so very much. And we're not going to abandon this topic. So again, if any of you all who are viewing have questions about health disparities or healthcare issues, feel free to put those questions in the chat. But we're going to move to you, Mr. Davis. And what do you?
And Denise,
what do
I
you
have one. I have one right here.
Okay.
And this one's put to, as we invited, so the candidates know, we did invite the audience to, if they wanted to direct a question to a candidate, to do so. And we'll give the other candidates 30 seconds to add on as well. On these, on these specific questions to a candidate, we're going to keep the answers to a minute when directed to a candidate, and then 30 seconds for everyone else to respond if you choose to. This is to Dexter Williams. The listener and viewer, you mentioned the need for cultural competency training in healthcare settings. What are the specific cultural issues that, if understood, would positively impact health outcomes? And you have 1 minute.
Thank you. I appreciate the question. And that example comes from my experience when I was working with my dad's doctors in the healthcare facility, and essentially he was being mistreated. I remember one physician was giving him the wrong information about his healthcare plan, and I had to step in. And so I think those are cultural competency issues that a lot of people of color face throughout the entire healthcare system. This is well documented, and my goal as council member is to make sure that we are doing everything that we can to prevent that, which is why I'm a big proponent of pushing for education so that our healthcare providers understand their patients from a cultural perspective, because it's a serious issue. It's an issue that a lot of my friends have dealt with. It's an issue that my family have dealt with. And so I just want to make sure that we're doing everything that we can in the city to make sure that the cultural competency is up so that we can improve healthcare outcomes. I mean, that's a small piece of it, but it's also pretty significant.
Mr. Williams. Denise, we have a question about transportation.
I think
Can I
you,
respond?
each person.
That's right. If you'd like to respond, that's right.
30 seconds.
Should have said it. 30 seconds.
So I think it's important. In this race, we have an opportunity to elect someone that has direct experience getting results on these issues. So not just talking about cultural competency, but when Howard University was threatened to be closed, which is the #1 producer of Black doctors who are cultural competent, I was the legislative staffer that drafted the amendment that led to Howard getting the resources that it needs to remain open. So those are the type of things where we have a candidate that has a track record of getting results. So you know that you're going to have someone when you elect them that's going to be able to get results. So I think on all of these issues, particularly cultural competency, it's important to look at that.
Thank you. Would another candidate, Lisa Gore or Councilmember Bonds, like to go? Ms. Gore?
Yes, I would like to say, just in terms of cultural competency, one of the things that I would highlight, and being a minority, being a woman, we all have experience in this issue. If you've gone to the healthcare system and you're Black or female, you have experience in this issue. One of the things I think the cultural competence should focus on is just the community's historic fear of the health system. So making sure that providers understand that minority communities, and specifically Black communities, have a historic fear of the health system, and that's for good reason. That's something that we can never lose sight of, and we've seen that with COVID vaccination rates here in DC, and that's something that we have to continuously work on.
Thank you. And Councilmember Bonds, do you want in on this one?
Yes, I will add to that. I think I saw something in the chat about this just a few seconds ago, and it just made me think about the fact that, you know, we as society cannot demand that those that provide us with health services act in a particular way. But what we can do is talk to their bosses, and that's the hospitals and the clinic heads, to make sure that they understand what the expectation is in our community. And I would recommend that we do that pronto, particularly when we find there is an issue. And also because they receive some funding from the government, our tax dollars, we're going to demand that they be responsive.
Thank you, Councilmember Bonds. In several of these questions, but particularly in the question addressing healthcare, transportation has come up as an issue. And Charles Turner, AARP DC Ward 8 liaison and resident, has asked, transportation has been a constant challenge to seniors. Even with the existing programs, their transportation needs are not being met. Council funding has not been sufficient to allow them to participate in senior meals programs and also wellness programs, and just that as you all mentioned, being able to get to those doctor's appointments or those places where they are dependent upon transportation. What we have to choose, he says, between the two. What will you do to increase senior transportation benefits? And we'll start with you, Councilmember Bonds.
Thank you for that question. We have had a number of changes in the transportation services provided to our senior community through the Department on Aging. But when all is said and done, we're very proud of what we really have in force now, and that is the Connector Card program, where based on your income is what you pay, but you pay no more than $5 for a ride, and you can use a taxi. And I believe we are now negotiating to not just have Uber, but including, I think, Lyft as another choice. So you, as a person who has the Connector Card, it's a membership kind of program. You have to apply for it. You have to have your name on a list. You have to move forward in that respect. You will be able to use that card to scoot around town, to go to your doctor's appointment, etc. If you need more assistance, you maybe, like, for instance, you need the lift to take you into the vehicle and your wheelchair. We also have that service, as many of you know.
All right, thank you, Councilmember Bonds. Mr. Fleming, you're next. And because I need to check the rules, Louis, because I thought we would be giving each one of them a minute to answer that question, since it wasn't done in particular.
Yeah, that's fine. Yeah,
Okay.
that's true.
All right, Mr. Fleming.
Thank you so much. So it's very important that we improve our transportation programs. We have 4 major programs. One is Metro Access. The other is the Connector Program, Senior Med Express, and Transport DC. Just this morning, I got my mom and her oxygen tank out and put her in a cab that came to her, and the cab took her to a doctor appointment where my wife met her. And that program has been essential to helping my mom meet her healthcare needs. So many seniors are at risk of missing their health appointments, and it puts their health at risk. So right now, we don't even know how many people use these programs because they can apply for more than one. So there's between 2,500 and 10,000 seniors that use these programs per year. And we had actually an instance where we ran out of money for the program before the year was out. That was about in 2018, I believe. So we need to invest more in these programs, but the demand is actually much higher than what we know, is because so many residents don't know about these programs. So because so many of our seniors are isolated, it's important for us to connect the outreach team to our seniors so they know about services in isolation. I asked my mom, how'd you find out about this service? She said, I found out by one of my friends that worked at DACL. So being connected is how she even learned about the program. And it's been such an essential service. Thank you.
Ms. Gore, Lisa Gore.
Thank you for this question as well. So I think that our transportation for seniors needs to be reliable, it needs to be easily accessible, and it needs to be affordable. So I would absolutely advocate, first of all, for our seniors in terms of public transportation to have no fee. I do believe that public transportation should be publicly available to everyone at no cost. And I know Councilmember Allen has a bill out there for everyone else, and our seniors get a discounted rate. But I think improving that accessibility by making those costs free would be the best option. In addition, I think we can't talk about this without talking about cuts to WMATA and ensuring that we have greater oversight of that. My area up here, which has the most seniors in the district, we had one of our main routes cut, the E6. That E6 bus took our seniors straight from the neighborhood to the main avenue on Connecticut, where they did their grocery shopping, got their prescription medications. That route was cut. The route that we have now takes them over a mile away from where their center of living is. So we have to think about that when we're talking about accessibility to seniors. Sometimes we're doing things that cut, our nose off to spite our face and make it not so accessible for them. The other issue that I think we need to concentrate on is having some of those ride shares provided outside of the district where some of their services are.
Okay, thank you. I think
Thank you.
you, Louis. I don't think they can hear us when
I
we
know.
speak.
I couldn't hear you. I'm sorry.
No, we can't hear you. That's true. We
Yeah,
don't hear
We
you.
can't hear you. Maybe a bell or a flag.
Yeah, that's a good idea. We might do that. Get the
so-
sheet of paper. I'm sorry. So I'm going to jump now to
that crew behind the curtain. Turn on our mics. Next question.
Did I get to answer that question?
Dexter Williams.
Sorry,
Mr.
Dexter,
Williams,
sorry,
your
Mr.
Oh,
turn.
it's all right. No worries. I think it's a good question. I mean, this goes back to what I've been talking about all night. The DC government needs to bring back the program where we were paying for rideshare and helping our seniors get to the grocery store, get to their healthcare appointments so that they don't miss it. It's critically important. I agree with my colleagues. This impacts their healthcare, but also we really need to evaluate our transportation programs. We have a number of programs, but we don't really know how effective they are. And we also need to look at best practices around the country. And third, the question I would ask is, for our seniors who are 75 and older, should they pay anything at all? I mean, they have lived a full life. They have dedicated a life to this community. And should we really be charging them? I think is a question that we really should be talking about.
Thank you very much. Louis? You can move on
I
now.
can move on now. Like, our next question is concerns housing. And I'm going to go in this order. It'll be Dexter Williams, Nate Fleming, Anita Bonds, Councilmember Bonds, and Lisa Gore. Herb Jones, one of our ARP DC ward liaisons, asks, does the definition of affordable housing need to be changed? He thinks this definition, he says, to me, does not really address the needs of low-income housing. Dexter Williams, does the definition of affordable housing need to change? And if so, how?
Yes, I think so. I mean, affordable housing to most folks is what you're able to afford. It's a real issue for our seniors. And one of the issues and things that I want to look at as council member are our seniors who are still paying property taxes. Right now, we have in our tax code of seniors who make over 100K, they still have to pay property taxes and because they count it as income. Some of them are still struggling. Just because they're bringing in other sources of income doesn't mean that they can afford it. So one of the things that I want to do is make sure none of our seniors are paying property taxes. Also, another housing issue that's been brought to my attention when I've talked to seniors across this city is, some of them who are in retirement, they live in these big homes and they want to downsize and they want to move to an apartment or a condo because they can't walk up the steps anymore in their own homes. And it's a financial burden. And so we need to look at what type of financial supports we can provide our seniors, but also how we can protect them from scams, because there are people who prey on our seniors and take the advantage of them, and also help them with financial planning as they live throughout their lives. And so those are my priorities as council member.
To the crew, give me my mic so they hear me. Nate Fleming, you're next. Go ahead, you have 1 minute.
Yes, to directly answer the question is about affordability. And right now we have 3 levels. One is 80%, and that's affordable housing that's affordable for families that earn about $110,000. So I think that's what the questioner is asking about. When I was at the council, I worked to create a bill to make sure that our housing fund, our main source for affordable housing funding, 90% of that fund should be spent not at 80% AMI, but at 50% and 30% AMI, which is what most people think of as affordability. But over the past 10 years, we've been spending so much of that fund on housing for families that can earn up to $110,000, and that's problematic. We had a specific property, the Reunion Square property here in Ward 8, where they only had 5 units that was affordable for seniors. And we had to fight the developers because they were taking DC money, and we turned that into 100% senior affordable building with 120 units available for seniors at affordable rates. Those are the type of things that we have to do throughout the city to make sure that seniors can afford to live here.
Thank you, Mr. Fleming. Councilmember Bonds.
Thank you very much for the question. I wondered when we would get to housing. Housing for our seniors is just too expensive for the most part. And on the issue of whether or not affordability or affordable housing's definition should be changed, probably it should in the colloquial sense, but affordability means for the District of Columbia that it is housing that is at 80% and below of the family median income. The family median income in the district today, and it changes periodically through the HUD guidelines. It is currently $125,000. That's the annual amount. And this is for a family of 4. And so when we talk about 0 to 30%, which is the bottom bucket, which I changed from 40% of the monies from the trust fund going to this category or extremely low income households to 50%, was to really highlight the fact that we have this tremendous need in the community. And so we're gradually increasing that number. But you and I know that when we talk about housing affordability, it's not what we are doing at the government level and how we designate the money. It's really about how people feel about the affordability.
Councilmember Bonds, because we have next behind you, Lisa Gore.
Thank you for this question. And, some of my candidates have said that there are different affordability levels. I'm not so sure that we need to change that definition. I think we need to recognize what those levels are. So 30, 80, 50% AMI. And I more importantly think that we need to work towards making sure that we provide affordable housing to the income levels that need it the most, and that's 0 to 30%. Those are our public housing tenants. Those are our families on vouchers. Those are our families, mainly Black and Brown, that have very low incomes. My platform strongly focuses on that, including strengthening the oversight of the Housing Production Trust Fund, strengthening rent control units, which about 10% of seniors live in. So I think there's a combination of things. I don't think that the definition is as important as what we're working towards in terms of achieving goals for providing housing to those deeply affordable levels, which is 0 to 30%.
Thank you so much. This brings to a close our open Q&A session. If you still have, staying with us, we're not done yet. The candidates each will get a closing statement. And if you didn't have a chance to put your question in chat, go ahead. You can be typing that right now. We'll do what we can to send these questions to the candidates. You might follow their Twitter feeds to see if your question gets answered. We don't have a way to get the answer back to you, but you know how to reach these candidates. And the candidates, I'm sure their staff are busy working now, putting their information inside the chat if they're smart and earning their pay. So we're at that point where we make closing statements. Time permitting, each candidate will have 2 minutes, and we have the time. 2 minutes to give a closing statement to the crew behind the green curtain. This is really important that our mics work, and the candidates here, Denise and I, we're saying time. If you hear Denise and I saying thank you, that's a polite way of saying you're out of time. All right, so we have 2 minutes, and the order in which we're going is this: Dexter Williams, Nate Fleming, Councilmember Bonds, and Lisa Gore. Again, ladies and gentlemen, if you're just joining us, or if you've been with us all night, we're at closing statements. And Dexter Williams, you have 2 minutes.
Thank you. And again, I want to thank AARP and the Washington Informer and my colleagues for being here this evening. I really enjoyed the robust and thorough conversation that we've had around issues related to seniors. I'm Dexter Williams. I am a native Washingtonian. I live in Ward 7. My mom's a retired DC public schools teacher. My dad retired from the DC Department of Corrections, and I have experience working at the DC Council for Councilmember at Large Robert White, focusing on transportation issues, environmental issues, and criminal justice issues, and also reentry issues. And my top priorities for our seniors are what I've been talking about this entire evening. We have to make sure that our seniors can age well in place. We have to protect our seniors from scams. We have to make sure that our seniors have access to broadband internet. And I have a plan to make sure that the city comes up with a comprehensive plan to actually do that. But also we need to make sure when it comes to housing issues in our seniors that we are relaxing the financial burdens on them. They've paid their debt to society. They have worked hard. They have committed to the community, and we should be doing everything that we can to make everything smooth sailing for them. I want to make sure that we bring back our transportation program where we are partnering with the rideshare companies so that seniors can get to the hospital and make their medical appointments on time, and also go to the grocery store. And so that's what I want to do for seniors. I hope that this evening you've learned more about me and my platform, and I look forward to continuing this conversation over the next 48 days. So thank you.
And thank you, Dexter Williams, and good luck to you. Next is Nate Fleming.
Thank you for AARP for your work. And thank you for putting out this forum. Thank you for the Washington Informer for co-sponsoring this forum. And 12% of our population, 85,000 older adults live in DC. But what's most important, this number is expected to rise to 25% of our population by 2030. So this next council member that you elect will be in office to position ourselves for that dramatic change. So I think it's important that we elect leadership that's strong, bold, effective, and creative, and has a track record of getting things done, particularly as it relates to older adults. Our transportation program, we have transportation programs currently for older adults. And those are the type of things that we need to expand. But when I talk to seniors, I hear things about the need for stronger dental programs for seniors. Right now, there's a bill that was passed by the council to expand support for dental programs for seniors, but it hasn't been funded. Those are the type of things that we need to act on. But the problems that impact seniors in Washington are the problems that impact all of Washingtonians, whether that's traffic safety, whether that's the fact that 1 in 4 of seniors in wards 1 and 8 are under the poverty line. Over 30% of our seniors are under the poverty line. issues like digital literacy. And we need people that are going to put bold, concrete solutions on the table to get results. I'm very proud of my work at the council, writing a law to expand the support that grandparents that take care of children and other older adults that are head of households, the support that they get. I'm proud that we're building another senior wellness facility in Ward 8, but we have to do so much more to make sure that the 75% of older adults that live by themselves are taken out of isolation so they can communicate with each other and build community in this city. And that's what I would like to do as your next at-large council member. Thank you.
Thank you, Nate Fleming, and good luck to you. Councilmember Bonds.
Thank you, and thank you to our audience in particular. Thank you for being with us this evening. Many of you, I believe I know, I've been before AARP before, and certainly am enjoying the opportunity to speak to you again. I wanted to just leave you with this understanding that as I have worked on your behalf over the last few years, I will continue to work on your behalf because this is a very important proposition that we have before our city. As some of my colleagues on this evening have pointed out, we are all going to be elderly if we're lucky. And we want to be lucky. And so the whole goal of having AARP and services for our seniors is, in fact, to make sure that we have the resources in which to not just age in place, but to age with dignity and with purpose. And so I do not see us all as being in need of an array of services as has been discussed this evening, but we certainly want to have a good life. And so in having a good life, that means we want to be embraced by the whole population. And that does mean that we need to concentrate on bringing those who are in isolation out of isolation. And that's a tall task, to try to figure out how to get people to come back into society and to know that we all care for each other. So that's one of the main focuses that I've made as we move forward. I'm constantly speaking to the agency about the importance of moving in that direction, trying to get movement. Am I out of time? Okay, I see stuff popping up, so I'm sorry. Okay, so I leave you with that message, and I look forward to continuing to serve you.
Thank you, Councilmember Bonds, and good luck to you. And last but not least, Lisa Gore.
Thank you, everyone. We had a great discussion tonight about the issues that are important to you and that affect you. What I would like for you to know is that this topic on senior issues didn't just come up for me when I got the invitation from AARP about the forum. Aging in Health has been a platform issue for me since I launched my platform. That is from my experience as an ANC commissioner, as experience as a daughter that has had her stepfather in senior facilities, and just understanding these issues from a firsthand perspective. I also have a policy team that's dedicated to aging and senior issues. If you'd like to be part of that team, go sign up on my website. But these issues are very important. I think we need new leadership in this area. I feel very strongly about the senior food insecurity issue and addressing that. And I feel very strongly about the oversight and the level of attention that our senior issues are getting in DC. That's my call for a council committee. And that's going to be my clarion call, because we need that oversight. We do have primary providers, but we have also sub-providers under that. And we need leadership in this area to make sure that we're going in the right direction. So I really enjoyed my conversation here. If you would like to find out more about my platform, please go to info@gore4dc, and that's my email. My website is gore4dc.com, and I look forward to working with you all. Thank you.
Thank you, Ms. Gore, and good luck to you. Ladies and gentlemen, you just heard the closing remarks of all of our candidates for the at-large race here at the District of Columbia. I'm going to turn now to my colleague to the left, who's going to start with our moderator closing statements. We get a chance of our own to make an appeal to you.
So first of all, I want to congratulate all of the candidates, Dexter Williams, Nate Fleming, Councilmember Anita Bonds, and Lisa Gore, for deciding that this job was important enough for you to step out here and run for office. And so we appreciate the time that you've taken with us this evening. We know that seniors need to know about where you stand on the issues that impact them. And even if you in the viewing audience recognize that you're not a senior, but you know a senior who needs to hear some of the conversation we had this evening, you know, this program is recorded. You can see it again on our Facebook channels. And so this is not the end of this conversation, but a continuing conversation as it relates to the issues impacting our seniors. I also want to say, and I know, Louis, you'll talk about the Mayor Forum that's coming up, but AARP and the Washington Informer will be producing a candidates voting guide for district residents. You will be receiving the candidates that are here, questions from us, but we will be putting that voters guide together that will be published on June 2nd. And so we hope that you will look out for that, and you will not have to have Facebook or the internet. You can pick up a copy of the Washington Informer and read the voters guide, and also see the candidates' responses to the issues that are most important to you. So I want to thank you so much for being with us this evening. I want to thank AARP. It's been a great partnership. And of course, the team that helped to bring this together. We appreciate all of the hard work that you've done to make sure that this was an informative and successful evening. Louis?
Thank you, Denise. A couple of announcements here and plugs. Everything Denise said, I want to back up and support as well. If you didn't know, AARP, 63 plus years in the making. It's a nonpartisan organization. We are an advocacy organization with a membership. We fight for people 50 plus and their families to live their best lives in ways that they choose. We do not support any candidates. We do not contribute to any PACs. We are completely nonpartisan in that way. It allows us to be objectively sharing facts with our members and non-members alike. Our purpose of doing tonight's event and other events with the Board of Elections that are coming up are to help people to know how to vote, not who to vote for, but to give them the information they need to make an informed decision when they go into the voting booth. To that end, follow us at arp.org/DC. Learn more about what we're doing. We have teletown halls coming up with the DC Board of Elections, sharing information again about the primary coming up and the general election, and how to vote mechanically, that is. I have a note here from my co-worker. You saw her write that? Oh, and June 21st. She said, if you didn't know, the primary is June 21st. How about that? Yeah, the primary is June 21st. That's the primary. One other, the Mayoral Forum, May 20th. Stay tuned. We'll be putting out information about that very soon. AARP is proud to sponsor that again with the Washington Informer, one of the few and remaining and great Black-owned newspapers across the country. If you didn't know, yesterday was World Press Day. So we should be happy. We have the Washington Informer here in the District of Columbia celebrating well over 45 years because we need somebody covering local news. And no one does it better than the Washington Informer.
57.
57. I said over 45. 57 is over 45. Thank you all so much. You can reach me if you need to send me an email. I'm at ldavis@arp.org. I welcome your direct contact. Everyone stay safe. To our candidates, good luck to you. See you out on the campaign trail. Good night, everyone.
Good night.